The information shared on the Sky Women's Health podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Reliance on any information provided by Sky Women's Health, Dr. Carolyn Moyers, or any guests featured on the podcast is solely at your own risk. You're listening to Sky Women's Health Podcast, your evidence-based resource for women's health and wellness, exploring the holistic principles of osteopathy, integrating mind, body, and spirit, designed to empower you as your own healthcare advocate and help you live your best life. I'm your host, board-certified OBGYN, Dr. Carolyn Moyers. Welcome, Sky community. Today, we are talking with a triple board certified physician in sleep medicine, obesity medicine, and internal medicine. This is a dream combination, and she happens to be the founder of DreamLife Medicine and Wellness. Dr. Paula Guzman, welcome.
Thank you so much, Dr. Moyers. It's a pleasure to be here. Thank you for inviting me.
Absolutely. I mean, it's my pleasure. I just finished telehealth patients today, and guess what we were talking about? Perimenopause and sleep, menopause and sleep. It's the hardest thing. I had a patient today tell me, I don't know what's going on, but I don't even like myself anymore. I can't stay asleep. And I think that it's complicating my life. And I'm like, yes, and we know we see, more elevation in cholesterol, more hypertension, all of these symptoms start presenting them in life. And a lot of times, it can be sleep related. If we improve sleep, everything gets better.
Yeah, absolutely. Yeah. Sleep directly impacts our immune system. It impacts our cognitive function, right? Because that's when we consolidate memories, when we consolidate our emotional regulation. So we may feel more irritable if we're not getting good quality sleep. And in perimenopause, unfortunately, that's one of the biggest symptoms that people can experience. 40 to 60% of women will have some kind of sleep complaint, whether it's waking up frequently throughout the night, not being able to stay asleep, waking up at 2 or 3 in the morning, or difficulty falling asleep. And all of that is multifactorial, but it can really impact your heart health, your brain health, your gut health, everything about your overall well-being. So very impactful.
Absolutely. Say more about the gut health.
Yeah, absolutely. So if we are in a kind of like a chronic state of stress, right, our vagal nerve, which directly connects our central nervous system to our gut, it can really cause us to have more inflammation, essentially. And so during our sleep time is where our body goes through the rest and digest period, right? Our gut microbiome is doing its thing, digesting what we had during the day. And so food and mind are very intimately connected. And it can affect how we feel in terms of brain fog and things like that. But it can also affect our sleep health.
Yeah, I feel like it's a vicious cycle. I can sleep, so I feel fatigued. So I make poor food choices throughout the day and I over caffeinate. And then I can't get to sleep. And then once I get to sleep, after 3 or 4 hours of waking up to pee, I can't get back to sleep. It's just this vicious cycle. So
Absolutely.
let's talk a little bit about why women's sleep is impacted during midlife. Like, what is that physiology, the changes that we start seeing?
Yeah, so during midlife, what we see is a dysregulation of our hormones, right? We think a lot about estrogen and progesterone start to go down. FSH, the hormone that stimulates the ovaries, goes up. And those hormones intimately control our sleep regulation in the brain. And so progesterone actually has anxiety reducing effects. It has a sedating effect. And so as we lose progesterone, we lose that trigger to cause us to get sleepy and to feel less anxious. And estrogen also regulates the signals that cause us to stay asleep. So it disrupts it causes sleep fragmentation. It disrupts that smooth sailing sleep pattern where we go through the different sleep stages. And that reduction in estrogen causes us to have much more of a arousal state. And so it's easier for us to get out of sleep. And once we lose our sleep drive, so what triggers us to fall asleep at night is the buildup of hormones like adenosine, which are sleep promoting. Caffeine is actually an adenosine blocker, right? So that's how that keeps us awake. But soon in that first couple of hours of sleep, we reduce our adenosine, we start to clear those sleep inducing hormones. And so it's really hard when we wake up in the middle of the night because we no longer have those strong sleep driving factors on
Right.
board. And so
Right.
that is a big factor of not being able to fall back asleep.
Yeah. And what I often hear is, this is when the mind starts churning and we start running through our list of things to do, or race, or thoughts just race and we can't get back to sleep. And then we try not to look at our phone, but we're wondering what time it is. And, universally, it doesn't matter what time zone, it's usually 3 a.m.
Yeah, right.
And they know their alarm is going to go off at 5:30 or 6. And they're like,
Yeah.
oh my God, I'm not going to give it. And so it's this vicious cycle. So let's talk about the insomnia prevalence in midlife.
Yeah, so insomnia, as I said, probably 40 to 50 to 60% even women may experience insomnia. And it can be a short term thing depending on where you are. And for some people, they're more likely to have predisposing genetic factors that may trigger them to have a certain either stressful event in their lives or hormonal changes that can cause insomnia. So the definition of insomnia, what makes it a disease or something that we would diagnose is if you're having trouble falling or staying asleep at least 3 nights out of the week for at least 3 months, right? So it's something that's persistent, it's ongoing, and it causes dysfunction during the day. So it's okay, and it's not unexpected for us to have like one night of disrupted sleep. Maybe the dog is on the bed, maybe our bed partner was snoring, something like that, right? But when it's persistent, there's these factors these thought patterns that perpetuate the insomnia. And so that's when we start to be anxious about our sleep, which actually makes it worse because now we're really focused on trying to fall asleep. And that by itself keeps our brain in an arousal state. So it makes it even harder. And so that's where we want to use the most effective treatment for chronic insomnia, which is cognitive behavioral therapy for insomnia. So it's rewiring those thought patterns that
Yeah.
perpetuate those maladaptive thoughts of, hey, if I don't sleep 8 hours, I'm going to have a terrible day, right?
Yeah.
Our brain will make that happen. We're going to
Right.
have a harder time falling asleep and we're going to feel crappy no matter
Right.
how much we
Right.
sleep.
How do you feel about the guided meditations for sleep?
I think those are powerful. I think, meditation for many people may seem like, oh, I just have to sit there and think about my breath. I don't want to do that. And it's really hard to put ourselves in that space. Even myself, right, as a sleep doctor, it's hard to turn the brain off when we have our phone and like every second we're being fed something interesting and like the algorithm is very effective, right? And
Oh,
so to
sure.
turn
Sure.
that off,
Your dopamine hits. You like,
yeah,
would you turn it
exactly.
right?
Exactly. So that dopamine is keeping us there. And so bringing awareness to it, like how often do I tend to scroll at night when I think I'm relaxing because I'm just shutting my mind off by not thinking about my problems. I'm thinking about what's on the phone. But bringing awareness to, hey, I'm doom scrolling right now. Let me shift gears. Let me try to do on Insight Timer, for example. It's a really wonderful free app that you can find different types of guided
What?
meditations. Insight Timer.
Okay.
Yeah. Yeah. We can put it in the notes afterwards if you'd like. But it's a free app and it goes through different types of meditations. And one of the core tenets of cognitive behavioral therapy is relaxation strategies like progressive muscle relaxation, right? So walking from your toes up to your head and each muscle group you squeeze, you tense it up and you relax. And it gives your brain something kind of active to think about, but it's also mindless enough that you're going to kind of drift into sleep if your brain is ready.
Yeah. Awesome. I think that that's gonna be really exciting to a lot of my patients who are frustrated and, don't wanna go on medications or have come off of Xanax, feeling addicted, and don't wanna go back that route and wondering, "Is this okay that I don't wanna be on medicines?" And I'm like, "Absolutely. There are
Yeah.
behavioral things that we can do." So I love that you're saying cognitive behavioral therapy first.
Yes. Yeah.
I think that's really
The
powerful. Cool.
the sleep guidelines say that, right? And so it's really unfortunate that in our society we don't have enough practitioners of CBT-I. And so in traditional medicine, it just doesn't seem to be as available. There's apps out there like the Go to Sleep program by the Cleveland Clinic. The VA made an app called CBT-I Coach, which is a free app that people can download. And it gives you pretty actionable tools on there to of things you can do instead of the doom scrolling in the middle of the night. Um, so those are tools, but the CBT-I guided programs, there's a shortage of people that can deliver that. But in our sleep American Academy of Sleep Medicine, number one first line treatment is CBT-I because it's been shown to be longer acting in terms of it lasts longer, the effect, the benefits. It has no side effects, right? Because it's not a
Right.
medication. And so it's more beneficial than medication. But in traditional medicine, and what I found in private practice in an insurance based model is many times patients come to me, they're already on one sleep med or they've tried several and now we're trying different ones. So I love the patients that say, I don't want to do medication because most medications are not meant to be used long term, right? It's kind of
Yeah.
like a band aid on the
Yeah.
fact that there's a lot of mindful approach that we can take that is
Yeah.
more effective.
Yeah. And I don't want to ignore the fact that, in midlife, when we are having hot flushes and night sweats that are disturbing our sleep, we need to address those. And so, yes, not only does progesterone, protect our endometrium if you have a uterus, but it can also, activate those GABA receptors and lead to that relaxation and help with sleep, but also addressing the hot flashes and the night sweats with your estrogen. If we're not hot flashing and night sweating and that's waking us up, then that makes a huge difference, right? So treating those hot flashes are really important. Treating those vasomotor symptoms are really important.
Yeah,
So,
absolutely. I think that's when we treat perimenopause and menopause, we're treating those symptoms. And so,
yeah.
if the sleep disruption is related to the hot flashes, we want to start there. If it's related to anxiety or mood disorder, right? If it's depression or if it's anxiety, and those sleep disturbances are a common symptom of that, then we want to address that first and then
Yeah.
see if the sleep gets better. Gabapentin is a great medication that can be a little bit of uh, it can be anxiolytic. It can calm the central nervous system, and it can help with the hot flashes, for example. So I would prefer something like that over trazodone. But I see trazodone being so often prescribed, and in fact, in private practice, what I found is insurance companies have you try trazodone. They make you try trazodone before they approve some of the more the newer medications, the dual or orexin antagonists. And so
Right.
those are the new medications that we would want to get approved, but they're so expensive. And insurance will tell you to do the thing that is likely to have more side effects. And so it's
Uh,
hard to navigate medicine in
sure.
the insurance world.
Sure.
It's
How do you feel
a
about
battle.
magnesium supplements at night, 5-HTP or L-theanine?
Yeah.
Um,
Yeah. I think L-theanine
multivitamins,
is a
like those are
great
some of the supplements that I use a lot.
Yeah, L-theanine I think is a great supplement. So is magnesium glycinate, right? It crosses the blood-brain barrier. It's a muscle relaxant. So those are two that I often see patients finding effective. And some patients like melatonin as well. That one is, hit or miss. We tend to use very high doses. So we try to recommend maybe 1 to 3 milligrams max and taking it 2 or 3 hours before bed. We tend to think of melatonin as a circadian rhythm hormone, which is what its function is. But we tend to think I just take it and I fall asleep, right? No, we actually have to give our body time for it to
Sure.
absorb and for it to have its function. So
Yeah.
several hours before bed.
Okay, so oftentimes when patients come in with a concern for sleep, we want to rule out or treat these vasomotor symptoms, try some progesterone, try some supplements, etc. But at some point, we may be thinking, we need to get a sleep study. And I feel a lot of resistance from patients on, getting a workup for their lack of sleep. Sometimes it's sleep apnea. Sometimes we need to consider a sleep study at home.
Mhm.
Talk us through that workup for patients.
Yeah, absolutely. So the big misconception is that for many of us, when we think of sleep apnea, we think it's a male disorder, right? And we think of a CPAP, and so we think, hey, my husband uses a CPAP. I wouldn't wear that, number one, and I probably don't have it because it's only my dad or my uncle or men in my life may have sleep apnea. So there's an under recognition that women are at high risk of sleep apnea, particularly because of those changes in hormones in peri and postmenopause. So before the menopause transition, yes, it's more common in men. After the perimenopause and menopause transition, it's equal in terms of the prevalence between men and women. So women's prevalence skyrockets in terms of sleep apnea. As estrogen and progesterone go down, the airway muscles get weaker, and so there's more collapse where, when you snore, it's the airway kind of closing, there's sound coming through. But there are times where there's an apnea, and that means the airway closed all the way. For at least 10 seconds, you essentially stop breathing. And if that's happening more than 5 times an hour, that's mild sleep apnea. More than 30 times an hour, that's severe sleep apnea. So women, we have to recognize that it can happen. It's fairly common and after the menopausal transition. And there are other treatment options that's not just CPAP, right? So when we think, hey, if I have the diagnosis, if I do the sleep study, what's next? Well, there's exciting new medications that may be coming out. But we can start with an oral appliance, right? So it's something that would be made by a dentist. It pushes the jaw forward to keep the airway open. That's pretty easy to sleep with. And it takes some getting used to, but it's easier than a CPAP. The CPAP, which is that mask that you wear at night, they get more and more minimal over time. And so there are masks that are very, very minimal, very comfortable to wear, and you get used to it. And it's an adjustment period. So we do have to do some cognitive uh, therapy over that of saying, like, hey, just start slow. It's going to take time to get used to because your body's not used to sleeping on something on your face. So once you get used to it, people say, hey, I've never slept this well in my life, right? And I don't go anywhere without it. Um, Weight loss can help with sleep apnea as another treatment, especially if it's related to excess body weight or a large neck, large tongue. Zepbound, which is an FDA-approved medication for weight management, has now gotten the FDA approval for moderate or severe sleep apnea. So that's the first medication for sleep apnea. It's pretty exciting. And there's another one down the line.
I just want to make sure that
Yeah.
patients are aware, like Zepbound, Mounjaro, tirzepatide,
Yes, tirzepatide. That's right. Yeah.
which is very effective for weight loss as well, and they go hand in hand. So this is amazing. And everyone midlife wants to lose weight. Everyone's got the new tire that they're carrying around that they're frustrated by.
Right, that insulin resistance. Yeah, fun fact is they've been studies showing that CPAP, it treats sleep apnea in the sense that it helps reduce those episodes. It helps reduce the daytime sleepiness that may happen from sleep apnea, but it doesn't treat the insulin resistance that happens from sleep apnea independently of your weight. And so sleep apnea causes insulin resistance because of this metabolic dysfunction. CPAP doesn't necessarily help with that, but yet Zepbound does, right? So I perceive a world in the future where we may want to use the medications in conjunction with, or maybe even above CPAP eventually. So that's how, in terms of physiologic benefit, I think Zepbound is wonderful. Tirzepatide.
Yeah, that's awesome. That's very
Yeah.
exciting, especially for all of our midlife women who are wanting to lose weight.
Yeah. The other, up and coming medication is it's a combination of a noradrenergic and antimuscarinic medication. That's the type of where these medications act. But essentially, they work on the muscle of the airway and prevent the muscle collapse in the airway. So these are oral medications that are currently being studied and reduce the severity of apnea by like 50%. So quite effective, and that's the first oral medication that may be undergoing FDA approval in 2026. So that's even more exciting for women who are like, I don't want to wear a CPAP. Well,
Y-
maybe we have an oral medication in the next couple of years. So there's a lot of advances trying to make the treatments more accessible, more effective as well.
That's awesome. That's very exciting. So tell us what we're looking for when we're going to see a sleep expert, because I feel like a lot of times patients leave kind of feeling like, want, want, want. I mean, not everybody is triple board certified like you. I think that this is a fascinating combination. If you're in the Florida area, guys, look up DreamLife Medicine and Wellness with Dr. Guzman, because what an amazing combo. You're really a powerhouse being board certified in obesity and sleep and internal medicine.
Yeah, absolutely. Thank you so much. Yeah, so in terms of what a comprehensive sleep assessment is, we look at your sleep patterns, right? We look at is there a circadian rhythm disorder, right? Over the lifespan, sleep changes. Our need for the quantity of sleep that we need changes between our teen years to our midlife to our elderly years. And so figuring out like what is the timing of your sleep patterns, right? So when you're going to sleep, when you're waking up, are you maintaining that consistency throughout the week, or is there a lot of fluctuations, right? When we tend to be, like the week we're working and we're probably sleep deprived, and then on the weekend we sleep in, and maybe we sleep until 10 or 11 a.m., and that's a huge drastic difference from your weekdays. That can be very exhausting for the brain. And so we want to kind of help regulate those patterns. We assess if there's daytime sleepiness, right? If there's snoring, if there's brain fog or depression. Some of those things could be signs of sleep apnea. So that would be the indication to do a sleep study. If you have insomnia, we should do a sleep study, right? Because we want to see, is there a sleep pathology that's waking you up in the middle of the night? Are you having disordered breathing episodes where your oxygen goes down? Or is there sleep fragmentation from the brainwaves? And during sleep, we can see if you're having these awakenings because of patterns in your breathing. And so that can cause, even if you don't have sleep apnea, it can cause you to feel exhausted during the day because your sleep was fragmented. Your brain waves weren't in this very smooth pattern throughout the night. And then we also look at the leg muscles. So there are conditions called periodic limb movement disorders where the leg muscles can twitch at night, and that can disrupt sleep. And we may not be aware of these leg kickings. And so if we're having daytime sleepiness, non-refreshing sleep, and we see a lot of these leg movements, then that there's medications we could use to help with that. And of course, exercise would be the primary factor to reduce those episodes. So I try to be as non-medication approach first, but then of course we want to use medications when they're appropriate and they're necessary.
Yeah. So, in terms of, I'm just thinking about all the menopausal women in my life, or the perimenopausal women who are going through this transition, who are really struggling with sleep, who we address the balancing the hormones so that most of life is better. And a lot of times it does fix sleep, which is wonderful.
Mhm.
But there's always those patients who are still struggling with the sleep factor. And so I'm just curious, as you kind of think about, because I'm sure you see plenty of women in your practice, as you think about that workup, at what point would you say we need to have that sleep study done?
I would say if we've tried treating the symptoms of perimenopause and menopause and we're still not feeling better, right? If we've treated the hot flashes and the night sweats and we're like, okay, that's better, but I'm still waking up in the middle of the night, that would be a quick factor for me to go ahead and order a sleep study. Sleep studies can be done at home now super easily. They can be just a watch on your wrist, a little thing on your finger, right? So it can be done in the comfort of your home. I like to do multi-night sleep studies because it's hard to assess your whole sleep health based on one night of sleep,
Yeah.
which is what traditionally we do when we send somebody to a lab. And so having multiple points to look at is really helpful. Um, and then if we rule out that your sleep patterns at night is great, you don't have sleep apnea, your legs aren't kicking, but you're still unsatisfied with your sleep, then we have to address, is there chronic insomnia? Is there maladaptive thoughts about our sleep and maybe our sleep expectation of how much I should be sleeping or how well I should be feeling when I wake up, right? And so that's where CBT-I comes in.
Yeah, absolutely. And hopefully we're incorporating a lot of those things early on. I know I definitely try to address that. But when you're doing comprehensive care for midlife, it can be very labor intensive in terms of like all the different topics. And sometimes I just feel like patients get overwhelmed. And so it's almost helpful to just focus on sleep for this visit and because there are a lot of different concerns that we're dealing with. Well,
Yeah,
Dr. Guzman, I could talk to you forever because these are all fascinating topics. I feel like there's 15 other more that we could come back to, and so I would love
absolutely.
women who are listening. Let us know what else you want Dr. Guzman and I to talk about. I would love to dive into sleep and weight health as well, because those are tightly related.
Yeah,
Thank you so much for joining us today.
yeah,
This is so
absolutely.
empowering, and I think that you bring a unique take on this with your training. Thanks for being here.
Thank you so much for having me, Dr. Moyers. I look forward to being back and continuing these conversations. Thank you.
Yeah, absolutely. I would love that. Until next week, be well.